Representative Roberts.
All right, good afternoon, everybody. Thank you for taking the time. There we go. Thank you. Good afternoon, everybody. Thanks for taking the time to join us on such short notice. Happy to be here with my co-sponsor, House Bill 32, Representative Judah, Garnett, and our Senate sponsor, Senator Donovan, who's on Zoom with us as well. We are very happy today and very excited to announce that we have been working over the last 3 weeks since this bill was first in committee on possible amendments with the healthcare industry and with our coalition of consumers and small businesses. And we have reached an agreement to offer a strike below amendment in committee tomorrow when this bill is heard in the House Health and Insurance Committee that will bring some of our largest industry partners to the position of neutral on the bill, all while still getting us to our end goal of lowering health insurance costs for Coloradans on the individual and small group market starting in 2023. So with the adoption of the strike below that we can talk about in a little bit, the Colorado Hospital Association will take a neutral position on the bill. The Colorado Association of Health Plans will take a neutral position on the bill. The Colorado Rural Health Alliance will take a neutral position on the bill. The SEIU will be neutral on the bill. And the Academy of Family Physicians will take a neutral position on the bill once the strike below is adopted. We've really valued and thanked the industry partners who have been working with us for many months, but particularly since the committee hearing a few weeks ago, and thank them for their cooperation and their agreement on some of these issues. And we're really happy because we think the bill gets it obviously to a better place for them, but it still keeps us on track to having a new health insurance option that is both lower in price and higher in quality for all Coloradans, no matter where they live, who purchase on the individual and small group market. So I'll turn it over to Representative Judah, and then we'll hear from Senator Donovan and the speaker, and then we'd be happy to take questions.
Thank you to Representative Roberts. First and foremost, I want to thank everyone who has made tremendous efforts in these past 3 weeks. It's been a lot of work, but incredibly well worth it. You know, the healthcare industry has really come to the table and has really been a partner in negotiations throughout this process, and really all of us coming to the table with one goal, and that is to provide quality healthcare for Coloradans. For me, I particularly want to thank the advocates and coalition who have stuck with us through this process. You know, it was a big deal for all of the sponsors on this bill, Senator Donovan, Rep. Roberts, and myself, to make sure that the integrity of this bill remained intact. The reality is that 13% of Coloradans have healthcare bills in collections, and that number jumps to 1 in 4 Coloradans in BIPOC communities. And this is not right. And so through this bill, we are really trying to address healthcare inequities and make sure that, again, Colorado realizes our potential that healthcare is in fact a human right and not a luxury afforded to you based on your zip code or color of your skin or even residency status. So for me, you know, making sure that we are addressing systemic racism and really systemic issues that have lived in healthcare was something that I am proud to say we achieved in this bill, and that we are taking positive step forward to start to chip away at the healthcare inequities while again providing quality access for people all around the state to have healthcare.
I can jump in then and add to just the excitement and where we are today. For decades, the price of healthcare in Colorado has just been on the rise. And for the 1 in 5 of us that struggle to pay for healthcare or make the devastating choice to go without having insurance, the current system just isn't working. And for the past years that I've been working on this issue, with many members in the General Assembly and our advocacy groups, our main goals were decreased cost or increased choice. We wanted more options for lower prices. And I think anyone who's been in some of these big stakeholder groups have been in them with me. I've always said, all options are on the table as long as we are achieving the goal for our constituents of lowering cost and increasing choice. And we never wanted to accept that there was nothing that we could be done to change the status quo, which is what a lot of people wanted to tell us, that this was just too big of a problem. It was too big of an issue to take on, and that we would never be able to respond to our constituents' needs. But we set out to make a change, and we invited anyone to the table that wanted to come to the table with solutions and ideas. And so excited to see that today we did get folks to the table to do the hard work of figuring out how to decrease cost and increase choice. The bill that we will see come out of committee tomorrow is a result of that collaborative process, and we will move forward together to ensure that all Coloradans have access to high quality and affordable healthcare. It's an exciting day.
Thanks so much, Senator Donovan. I'm just really here to compliment the firsthand work that I saw the sponsors put in over the last month, really bringing everyone to the table and making sure they can deliver on the number one thing that I hear from my constituents and that we hear from people across Colorado, which is healthcare costs are too high, and people are having to make the impossible choice about maintaining coverage and or making ends meet in other ways. And that is a choice that no Coloradan should have to make. And I know that Senator Donovan and Representative Roberts have been working on this issue for years. And I really want to compliment them for their persistence in making sure that they can deliver on what so many people expect from government, which is that we work on behalf of them to help them drive down the cost of healthcare, make sure that they're not looking at double-digit premium increases year after year, and that they can use those dollars, especially in a downturn due to a pandemic, they can use those dollars to make sure that they don't fall behind paying their bills in other ways. And really watching Representative Judah and Representative Roberts here in the House over the last, since the bill was in committee, has shown me that bringing everyone together and allowing the legislative process to work is something that is achievable and everyone should strive for. So I'm really here just to compliment the sponsors and to compliment the road that they have taken to get here. Obviously, there's still a road ahead, but the announcement that Representative Roberts led with at the beginning of this call really is a testament to the hard work that they've put in and the hard work that they've put in every step of the way. So I just really wanted to highlight that, thank them for their work, thank Senator Donovan for her leadership that has never wavered, as this issue has obviously very important to members of the Senate and to the same constituents across the state. So I'm just here to say thank you to them, and that I look forward to committee tomorrow and the next steps through the legislative process.
All right, we good to go to questions? All right.
Jesse, go ahead.
Hi, folks. So presumably you guys were talking to the different industry groups before you introduced this bill. So why wasn't the original version of the bill, this standardized plan? And then also, I'm hoping you can talk about how this will actually reduce costs. The original version required certain cuts be made, but this one seems to let providers choose if they want to accept this standardized plan or not.
So to your first question, the introduced version of the bill was a starting point for us, and I think a starting point for negotiations. It's something that we had been working on for months, and we did really want to give the healthcare industry the opportunity to lower costs on their own, and that's why we built in the two-phase approach. But we heard some constructive feedback during the committee hearing that drove us back to the negotiating table. We had certainly been talking about this idea before committee, but once we decided to go to that first committee hearing and hear the testimony, we thought we could reopen those negotiations. So I think it was certainly a starting point, and with always the possibility that we would end up here. how this will work and how the strike below, which will turn into the bill, will work is that we'll actually get to lower costs sooner than the introduced version of the bill. And so that's a really positive development on our front for our constituents. But we will be still creating the same standardized plan that the introduced version of the bill puts in place, which is a higher quality plan with lower deductibles and cover more essential health benefits and first dollar services. But instead of being offered by a nonprofit entity, it'll be offered by existing insurance carriers that already operate in our state. So we get to utilize their infrastructure and actually save a lot on administrative costs that will then pass down to consumers as well. But the standardized plan will be set up. It will be a new plan that hasn't been offered before anywhere in the country in this way, let alone Colorado, and it will be offered in every county in the state as well. But just by utilizing existing infrastructure and not setting up that nonprofit entity, we've been able to strike this agreement and this compromise with the industry, and we think it's a positive development.
Andrew.
Thanks.
One thing that I heard while calling around to experts was basically skepticism about why the health industry would get on board with something like this. Why do you think that this was worth it for them? Why would they agree to something that includes the possibility of rate setting and premium cost limits, things like that? What brought them around? Was it, the threat that you would do something worse, or did they see opportunity in this?
I can jump in, and if my co-sponsors have thoughts too. I think what was telling, Andrew, in the committee hearing is that almost every single person that came to testify, whether they were super supportive of the bill or very much against the bill, they all started their testimony with, "We know costs of healthcare in Colorado are too high." They all acknowledged that. They just said this introduced version of the bill isn't the right way to get there. We think that this is a really reasonable step forward because it utilizes already existing infrastructure, whether it's our insurance industry or our healthcare network through our hospitals and providers, and puts different new rules in effect that will lower the costs and increase access. And at the end of the day, this is a more affordable insurance plan, which means that more Coloradans will have access to insurance, which means that more Coloradans are going to be purchasing insurance from insurance companies and going to their hospital. And I think it's better for the industry as well when they see more patients. So that's been part of the conversations, and certainly the status quo is not acceptable, and a lot of people even in the healthcare industry know that, and so that's why they met us halfway to reach this agreement.
And Andrew, I think it can be simple business as well, right? The more folks that they see that are actually insured, they get paid for their services. And I think, any industry should get paid for their services. You have docs who go to school for decades for their specialties to save lives. They should get paid for that expertise. And so we want to make sure that hospitals and providers are in fact getting money in the door for the services and care that they are able to administer.
Marianne.
Yeah, hi. My understanding is that despite the fact that we have this strike below, there are still amendments that are being proposed for the bill for tomorrow. Can you talk about those?
So the strike below is certainly the main amendment, and then there are some smaller, more technical amendments that will be also brought tomorrow. And I imagine we'll be working on some smaller technical amendments as the bill works its way through the process. Both Rep. Judah and Senator Donovan and I, we have an open door policy. We're always willing to take meetings and hear from stakeholders about different things that need to be tinkered with so that when this does become law, it works as intended. But certainly there's not multiple strike belows. This is the main thing that we'll be considering tomorrow in committee.
My understanding is that the Colorado Medical Society has taken a position of opposition to this bill. Is there a way to get them back on board?
So my understanding is the Colorado Medical Society is in an amend position, and we've been having productive conversations with them as well, and we'll continue to do so. I think doctors in our state very much care about making sure that Coloradans have access to affordable health.
So we're going to do 5 ounces.
Their doctor.
All you have to do is, first of all,
Andrew.
There you go. We'll continue to work with the medical society. They have been very much a part of the negotiations during all of this. They will continue to be.
Saja and then Jensen.
Thank you. Can you talk a little bit about how you'll hold these providers or these carriers accountable? So there are these rates, but there's no longer a threat for a public option. So what makes sure that these rates are reduced?
Yeah. So I think the easiest way to think about this is the introduced version of the bill had a phase 1 and a phase 2. Phase 1 was completely voluntary, and if they weren't able to meet the metrics in phase 1, phase 2 would kick in. We're getting rid of phase 2 essentially and moving everything into phase 1, and we're also creating that same voluntariness period followed by a level of enforcement if needed. So they will be given a premium reduction target. It's 18% reduction over the course of 3 years, so 6% a year for 3 years. And we will allow insurance carriers to negotiate rates with providers across the state to achieve both the premium reduction target and the adequate network. If they're able to do that, and we believe the vast majority of them will be, then they'll enter that contract and start selling those plans. If they are unable to either achieve the premium reduction target or create an adequate network, then there will be a rate hearing with the Division of Insurance where everybody will get to present evidence as to why they weren't able to achieve those metrics. And then the network and the rates will be created for that specific county or for that specific plan. So that is the level of enforcement. We hope that most will never even get to the point of a rate hearing, but we've been working really closely with the insurance carriers and the providers to come up with the details of what those rate hearings will look like if and when they're needed. And that's part of what got them to a neutral position today.
Jensen?
Yeah, that was sort of my main question, but I do also just want to ask, is this still sticking to the individual and small groups? And if so, sort of given the positive discussions that you've had so far, do you see this working for larger groups in the future?
I think our focus, go ahead, Representative.
Oh, I'm sorry, Senator, please.
No, it is still with the individual and small group, which we are really excited about because having that small group aspect on it is really important for the small business community across Colorado to be able to talk about health insurance as part of their business plan to take care of their employees. And I think that was some of the most powerful testimony we heard in the first committee as well. Our focus has always been to address the individual and small group market because that's where we're hearing from our constituents of where the prices are not affordable to be able to do the responsible thing of having health insurance. So our focus has remained on those, and the compromise bill that we negotiated in order to lower cost and increase access remains focused on the individual and small group market.
All right, everybody. I don't see any other hands raised, but thanks so much for tuning in, and don't hesitate to reach out to either the House or Senate comms team or the sponsors if you have additional questions or additional media inquiries. And we just really appreciate you guys taking time out of your busy day on such short notice.
Thanks to everybody.
Thank you.
Thanks, everyone.